Good morning, viewers. Welcome back to Brawi Jaya News with me, Khalil. Our today's news came from Indonesia, where there's no longer hidden victims. Children are dying as virus surges in Indonesia. Hundreds of children in Indonesia have died from the coronavirus in recent weeks, many of them under the age of 5. A mortality rate greater than that of any other country, and one that challenges the idea that children face minimal risk from COVID-19. The deaths, more than 100 a week, this month have come as Indonesia confront its biggest surge yet in coronavirus cases overall. The jump in child deaths coincide with the surges of the new Delta variant, which has swept through Southeast Asia, where vaccination rates are low, causing record outbreaks not only in Indonesia, but in Thailand, Malaysia, Myanmar, and Vietnam as well. Indonesia, the world's fourth most populous nation, this month overtook India and Brazil in the number of daily cases, becoming the new epicenter of the pandemic. The government reported nearly 50,000 new infections and 1,566 deaths among the entire population on Friday. Based on reports from pediatricians, children now make up 12.5% of the country's confirmed cases, an increase over previous months, said Dr. Aman, who is also the executive director of the International Pediatric Association. More than 150 children died from COVID during the week of July 12th alone, with half of the recent deaths involving those younger than 5. Overall, Indonesia has reported more than 3 million cases and 83,000 deaths, but health experts say the actual figures are many times higher because testing has been very limited. On Sunday, Indonesia President Joko Widodo extended some restrictions and gatherings commerce through August 2nd, but relaxed others, such as allowing traditional markets to resume operating as usual with strict health protocols. More than 800 children in Indonesia under the age of 18 have died from the virus since the pandemic began, Dr. Aman said, but the majority of those deaths have only occurred in the past months. Until now, children have been the hidden victims of this pandemic, said Dr. Yasir Arafat, Asia Health Advisor to the non-profit group Save the Children, but not anymore. Health experts said the number of factors contributed to the high numbers of deaths among children. Some could be vulnerable to the virus because of underlying health conditions, such as malnutrition, obesity, diabetes, and heart disease, doctor said. The country's low vaccination rate is another factor. Just 16% of Indonesians have received one dose and only 6% have been fully vaccinated, according to our world data in a data project at the University of Oxford. Like other countries, Indonesia does not vaccinate children under 12 and only recently began vaccinating those between 12 and 18. At the same time, many hospitals have been stretched beyond their limit by the recent surge in the cases, with patients waiting in hallways and overflow tents for a bed in a ward to open. Few hospitals are set up to take care of children with COVID. With hospital at a capacity, about two-thirds of adult patients are in isolation at home, which increase the chance of the children will be infected, said Edi Rahmat, Executive Director for Indonesia at the non-profit healthcare group Project Hope. Dr. Aman said educating the public getting more to comply with health protocols would be a good start in protecting children. Up next, we're going to have a wonderful news from the Tokyo Olympics. Team USA is sporting origami masks and air-conditioned jackets for Tokyo Olympics. The long-awaited Tokyo 2020 Olympics are underway, and Team USA has been making headlines at the Games for not for their performance, but their outfits. The national team's Bane light mask and high-tech cooling jackets have captured the imagination of the public and made heads turn. First, let's talk about the unique mask being worn by the US athletes. The slightly oversized white mask seems like a common KN95 mask, but the ridges makes it stand out, with some on the Twitter, even the Tokyo official Olympic account, making comparison to the mask worn by DC villain Bane, while others see it akin to the iconic mask worn by Hannibal Lecter. The mask was actually designed by Nike for Team USA. They said that it was inspired by the Japanese traditional origami. The unique origami-inspired plated design allows for optimal airflow and air volume within the lightweight mesh mask, said the apparel designer. The mask is apparently called the Nike Venturer. Although it looked like a KN95 mask, it's actually not a medical grade at all and functions more like a normal cloth mask. So you should still think about double masking when wearing this in public. Pictures of the Aventurer Max show it will be sold in black, come with a case, and multiple different size straps are included. The Team USA also came prepared for the summer heat as Ralph Lauren designed some special clothes for the left flag bearers participating in the opening ceremony. Dubbed the real-life cooling jacket, the state-of-the-art piece is referred as being air-conditioned as the jacket contains a battery-powered, self-regulating temperature cooling device. Ralph Lauren said while only flag bearers are getting the jacket for now, all Team USA Olympic and Paralympic athletes will get one later on. The device seemed to be at the back of the jacket and worked through a fan at the back of the neck to disperse heat from the wearer's skin. The company compares the jacket system to fans that cool the world's most advanced computer systems. This actually seemed quite similar to Sony's Reon Pockets, a wearable air conditioner that you stick on the back of the shirt and it dissipates heat from your body. There's been no word whether the real-life cooling jacket will be sold to the public. Well, that is all for today's news, folks. And if you want to see more, go to www.www.news.com. Stay strong, stay safe, and have a great day.